Cystitis, that is the bladder infection, usually presents as lower abdominal pain, that is pain in the suprapubic region. It can cause a frequent desire to urinate. It can present with blood in the urine, and it can also present with urgency of the urine. In case of pyelonephritis, it is what is called infection of the kidney. Patient can present with fever, can present with flank pain or back pain, and can present with bloodstream infection of the infection. How will you diagnose urinary tract infection? So, usually it is diagnosed when they present with typical symptoms either of lower urinary tract, that is bladder infection, or upper urinary tract, which is also called complicated urinary tract infection based on the kidney infection. You do a urine test which shows plenty of pus cells in the urine. Sometimes it can have red blood cells also, and when you have a suspicion of urinary tract infection, you do what is called a urine culture and sensitivity test, which can identify the organism which is causing the infection and which can guide the treatment. Recurrent urinary tract infection, this means a patient getting infected repeatedly with bacteria. There are certain conditions which can predispose to recurrent urinary tract infection or recurrent UTIs, namely a patient with diabetes, children with vesicoureteric reflux, and elderly patient with lower urinary tract obstruction, like patient with a prostate obstruction, and this can also lead to persistent urinary tract infections.
A surgeon's role in urinary tract infections is not very common, but in acute infections, whenever there is pus accumulation in the kidney, we might have to drain the kidney down with what we call as a double J stent or a percutaneous nephrostomy, wherein a tube is placed directly into the kidneys to drain out the accumulated pus. In cases of recurrent infections, we need to identify if we are actually missing some cause. Once the patient is optimized medically, we need to understand why the patient is actually getting a repeated infection of the bladder or the kidneys. In children, they might have something called as a vesicoureteric reflux, which is nothing but the urine goes up against the nature from the bladder up into the kidneys, or it could be something like a stone which is causing an obstruction for the passage of urine from the kidney down to the bladder, or in elderly people it could be because of prostate enlargement which causes some obstruction to the passage of urine from the bladder to the outside, leading to retention of urine in the bladder. If we are clearly able to identify the predisposing condition like the stone or the prostate, the causative factor needs to be addressed. It might require the clearance of a stone, or it might require the prostate surgery. Notwithstanding, some people can have what we call as persistent urinary tract infection, wherein the urinary system always remains infected. We need to see whether this is going to be pathological by identifying if there are any hidden missed conditions which can lead to a curative. Notwithstanding all these, some people may have persistent urinary tract infection. In children, as listed, it could be because of the vesicoureteric reflux, or it could be because of mere elderly age and diabetes, or it could be because of the obstruction present in the urinary system, mainly because of some hidden stone, an infection stone, or it could be because of the prostatic enlargement per se. The causative factor needs to be identified, and it is imperative that we clearly identify and treat the causative factor. If you have any of these symptoms or any repeated infections of the urinary system, you can contact us at MGM Healthcare in the uronephrology department.